Hello, I'm Katie Branning, and I will be demonstrating Piggyback IV administration. First thing I'm going to do is check the doctor's orders and compare them against the MAR. The doctor's order is for 1 gram of Versepin to be infused over 30 minutes in a mini bag of 50 milliliters of normal saline solution. So I'm going to verify that I have the right drug, the right dose, the right route, and the right frequency, and also the right patient. The next thing I'm going to do is check the patient's lab values of ALT and AST, since this drug can be toxic to the liver and the kidneys. Also, I'm going to keep in mind that this drug can be ototoxic also. I'm going to make sure that the patient doesn't have any allergies to penicillin or cephalosporin. Okay, next I'm going to calculate my drug dosage. The doctor's order is 1 gram in 50 milliliters to be infused over 30 minutes with a drop factor of our piggyback tubing, which is 10, which will give us 17 drops per minute. So I'm going to pull up 4.8 milliliters of Versepin. I'm going to clean the port on the mini bag. Then insert the medication.
We're also going to use this as a mini bag separately, or are we going to use this one? But you have to show.
And now I'm going to mix the medication. And I'm going to apply a label, which has the client's name, the dosage, the drug, the time, and my initials. And next, I'm going to and prime the line to the end, and primed, close it again, and now I'm going to add a label to our tubing with my initials, the date, and the time. Okay. All right, and I'm going to go into the patient's room, and I'm going to say, hi, Mrs. White, my name is Katie, and I'm your nurse today. I'm going to be administering some antibiotics through your IV line. I'm going to ask for 2 patient identifier, being name and date of birth, and I'm going to ask Mrs. White if she has any known allergies against penicillin, especially, and other antibiotics, just cephalosporin. Okay. I'm going to assess the existing IV site and probably make sure that we don't have any heat or lymphobitis or any coolness from an infiltration. And it looks good, and Mrs. White doesn't complain of any pain at the site. Okay, so I'm going to take our existing line and drop it down lower.
This is what happened after simulation too, or when we were practicing. I had to mess with it till it stopped. Here is. All right, so y'all want to just fill in the IV first and get that done.
And by calculations of 1 gram and 50 milliliters with the 10 tubing, I have a drop rate of 17 drops per minute. So now I'm going to hang our other drug.
Do we use the water cup? When are you supposed to in real life?
Click the primary line. And I'm going to clean the port. And I'm going to and I'm going to open and I'm going to count. Well, and we're going to count for 17 drops per minute. Okay. And good. And I'm going to make sure that we don't have any drainage at the IV site. Are you feeling comfortable, Mrs. White? Good? All right. Periodically over the infusion time of 30 minutes, I'm going to come back and monitor the site and assess for any signs of a skin rash, anaphylactic reaction. Also, I'm going to keep in mind that this drug can be autotoxic and do damage to the kidneys and the liver. Okay, so I'm going to pretend that I left the room, and I'm going to come back in, and I'm going to see that the infusion is over and the drug has been given, the Rocephin has been given, so I'm going to
We can move that arm.
our piggyback
That's
line.
that arm, right? Is that what you said?
Yeah, I think we should use this arm.
Switch arms.
And then come
They all
forward,
do.
and I would attach a new alligator clip so let it be used again,
Not too bad, but it does if you squeeze on it.
and then I
Right
would
now, they're all going to.
resume the drip on the primary line and make sure that the drop rate is set. I'm going to assess the access site and for any redness, for any drainage, any swelling, any coolness, and it looks good. I'm also going to reassess Mrs. Spike for any reaction to the drug, and she looks good, and I'm going to tell her to call me if she has any concerns or any reaction.
Oh, there's some right here.
Once I am done, I'm going to document in the MAR the drug that was given, the time, the date, the drug, the dose, the route, and I'm also going to state that the condition of the IV site was good, and I'm also going to monitor, I'm going to record how much was infused from the piggyback bag into the patient's input and output.